So if you're stuck then with the genetic factor of having the high cholesterol, is there anything you can do about it, or is it simply just that's it over?
So there are some people who have certain genetic abnormalities, which I think we're going to talk about later, that they have really high levels of cholesterol, and they have these defects where they truly don't clear cholesterol properly. And in that case, diet, exercise, why we always encourage it for lots of other reasons, medications are required in order to really get those levels down. So, and it's really individual. Some people with diet and exercise, you know, we always say on average you expect this % reduction in your lipid panel with diet and exercise, but there's always going to be people that fall out of that spectrum. So it's really important to know that we encourage diet and exercise, and some people it's going to have a much greater impact on their levels. But for the most part, when we look at the average, we're not going to get the reduction. I mean, and if you need that big a reduction,
not to bury the headline, because I know we're going to talk about this, but that's the concept of the lipid clinic and the concept of lipidologist, which is not treat everyone the same, don't treat everyone's number the same. Everyone's body's different. The reasons they may have these numbers are different. The risk associated with it's different. So to come in and individualize, whether with other blood tests or aspects of the family history, you know, if your cholesterol is 300, which is very high, and your parents were 300, which is very high, and they're living and they're 80 years old, and your grandparents were 300, which is very high, and they're doing great and they're 110, then we can tell you that, yes, you have a high cholesterol, but you're one of those people where it doesn't get into the arteries. So there's many components, including family history and genetics, that we look at, and that's the individual approach that we do in a lipid clinic. It's not just say, everyone with this number takes this pill, everyone with this number, you're fine. It's much more complicated than that.